group of pharmacists in Tennessee working to expand education and access to vaccines, especially in rural parts of our state where health care might not be quite as accessible. Thank you for joining us for News 2 at 4. I'm Mark Kelly. The Tennessee Pharmacists Association working with pharmacies in all 95 counties, helping administer close to 35,000 vaccines. And that was over the past year and a half. And it's through the Closing the Gap initiative. State Capitol reporter Tori Gessner explains the impact.
In the quiet rural corners of Tennessee, access to health care can be a daily challenge. Some communities looking to their local pharmacies as safe havens. Inside, there's a hum of conversations about health care, including the value of vaccines.
Vaccines are a critical piece to the public health of our state, of our county, of any community.
Education and expanded access to immunizations, the focus of the Tennessee Pharmacists Association's initiative, Closing the Gap. With funding from the Department of Health, the goal for the past year and a half was to help unvaccinated and under-vaccinated Tennesseans get accurate information about vaccines and get their shots through pharmacies across the state.
When we have research that demonstrates the value of what an injection does to help prevent various types of diseases, it's a critical piece.
Local pharmacists gave nearly 35,000 vaccines across all 95 counties through Closing the Gap. Almost half the shots given were for the flu, but the initiative also increased vaccine rates for COVID, herpes, RSV, and pneumonia shots. The program also educating pharmacists on how to talk to patients about vaccine hesitancy, helping facilitate more than 52,000 conversations about the problem. That, according to the Tennessee Pharmacists Association, only got worse due to the pandemic.
There was always questions that individuals had about the effectiveness and the value of vaccines. I think what happened through the pandemic, it just spurred more questions. And so what we saw even through the course of this initiative is that pharmacists had to have multiple conversations with the patient or their caregivers.
Closing the Gap, proving pharmacists do more than just dispense medication. They're key healthcare providers in the community. Reporting in Nashville, I'm Tori Gessner.
Tori, thank you. So the Tennessee Pharmacists Association is still waiting on that final data. That's from the Department of Health on how Closing the Gap improved the vaccine rates across the state. The TPA is also working to teach pharmacists about ways they can make this practice sustainable, really from a business standpoint as well, through insurance payment options.